Hi, I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine here in Houston, Texas today. I have Miss Sally Ryan. She's here to explain how she's had some successful treatments here at our practice regarding her knee pain after total knee replacement on both knees. Thanks for being with us, Ms. Ryan.
Thank you, Dr. Manzi. I'm happy to share my information with anybody that's interested.
Great.
Back in May of 2013, I had my first of 2 total knee replacements. And while I was still in the hospital recovering, I developed an extremely uncomfortable hypersensitivity, is the way I refer to it, on both knees. It was bilateral. And
Okay.
The sensation that I was experiencing was rather like someone who's handled fiberglass insulation and gets some under the skin, and it's just, you just want to claw your skin off to get rid of it. And that's what I was experiencing on both knees.
That must have been terrible.
It was nightmarish. I was miserable. And my first stop was to the surgeon that had done the surgery, and he said, "Oh, I've just never had a patient experience that before." And
Okay.
I was not sure I believed him, but nonetheless, he sent me to see a neurologist in his building. And after about 9 months of wasting my time with that doctor, who really didn't have anything to offer, I started looking around for someone who could actually give me some relief. And I was referred here by a neurologist, and I have been with this practice now for what?
It's been a few years.
Yeah, it's probably more than 2. And I finally am getting the kind of treatment that has offered me a fair amount of relief from this misery.
I remember when I first met you, you had excruciating pain. I could hardly even touch your knees, and you complained about how you couldn't even let the sheets touch your knees.
Exactly.
And now you still have a little bit of hypersensitivity, but we've gone through a few rounds of radiofrequency ablation, which has helped over those nerves that go to your knee joints.
Right.
Even though it's not your knee joint anymore,
Right.
the nerves are still
Yeah.
there, and they're letting you know you've had pain.
Right.
And you've also done some therapy here.
I have done some therapy here, which was kind of interesting and fun. And
That's great.
The medication has, offered me a fairly comfortable life day to day. There are rare occasions when it will flare up and nothing seems to help, but those are few and far between these days.
That's great. So we can repeat the ablations up to once every 6 months to a
Right.
year. We use medications, we use therapies, and all these other multimodal treatments to keep you as functional and active as possible.
I will add, though, that it has made a major impact on my wardrobing choices. I really can't wear long pants or anything that rubs against the surface of the knee. That really sets me off. So I probably have the largest collection of skirts, maybe in the whole country.
Well, I'm going to see what else I can dig up to see if I can even better control that nerve pain you have, which I have diagnosed you with what's called complex regional pain syndrome over the knees, which can happen after any type of surgery. And it's rare, but I do have a decent amount of patients with this condition, and I feel like here at Performance Pain and Sports Medicine, we can definitely decrease that amount of pain that you have suffered from.
If you are anyone that has anything similar to this situation, this is the only place to be. This is the only practice, I believe, that really understands what we are going through and really is committed to making our lives as comfortable as is humanly possible.
Ms. Ryan, that is so heartfelt. Thank you so much. I really appreciate
And
you.
that was unsolicited, by the way.
Thank you.
I really believe it. I really believe it. Because I kept shopping around for different doctors who could help me, and only when I finally hit this place did I finally get some meaningful relief from this very uncomfortable sensation that I feel.
Well, I'm here for you, and we look forward to treating other patients. Thank you for sharing your story.
Absolutely.
And I hope I can help other patients, both myself, Dr. Suzanne Manzi with Performance Pain and Sports Medicine, and my partner, Dr. Matt Wiederholtz. We have lots of options for other people that are suffering, and thank you, Miss Sally Ryan.
Absolutely. Thank you, Dr. Manzi.
Thank you.
You've been a lifesaver.